Hello, in today's lecture we will discuss about the trapezius muscle, which you can see in yellow. It is one of the cutaneous and superficial muscles of the neck. We will discuss its superior attachment, inferior attachment, innervation, and main action of trapezius muscle. Let's start with the superior attachment. Mainly, it attaches to the medial third of superior nuchal line, also the external occipital protuberance, also the nuchal ligament, and the spinous processes from C7 to T12 of vertebrae, and also lumbar and sacral spinous processes. These are the main superior attachments of trapezius muscle. What about the inferior attachment? Inferiorly, it attaches to the lateral third of the clavicle. This is the clavicle, this is the lateral third of the clavicle. Plus, it attaches to the acromion and spine of the scapula. So, inferior attachments are lateral third of the clavicle, acromion, and spine of the scapula. What about the innervation of trapezius muscle? Main innervation is spinal accessory nerve, which is 11th cranial nerve. Also C2 and C3 nerves, which is mainly pain and proprioception nerves. So these two main nerves are the nerve supply to the trapezius muscle. So for motor action, it is spinal accessory nerve, which is 11th cranial nerve. And for pain and proprioception is nerves from C2 and C3 roots. What about the main action of the trapezius muscle? Main action of the trapezius muscle is that it elevates, retracts, and rotates scapula superiorly. It has different fibers, and these different fibers has different functions. First is the descending fibers. Descending fibers elevates the scapula, so shoulders, maintain level of shoulders against the resistance. What about the transverse fibers? The transverse fibers retract the scapula. What about the ascending fibers? The ascending fibers depresses the scapula, so it depresses the shoulders. And descending and ascending fibers together, they rotate the spinous processes of scapula. So unilateral contraction of these two fibers, of these descending and ascending fibers, unilaterally, which means on one side, contraction produces the lateral flexion to the same side. So these main three fibers has different functions. So descending fibers elevates scapulas, transverse fibers retract the scapula, and ascending fibers depresses the scapula. So, what are the main nerves that supplies the trapezius muscle? We discussed about spinal accessory nerve, which is mainly motor supply, and C2 and C3 nerves, which is pain and proprioception. Main action is pain and proprioception. That's it for this lecture. Thank you.